I'm a pain management nurse, and that's why I'm here before you today. There's about 76+ million Americans who suffer with pain every day. It's probably the #1 reason why people go to a healthcare professional in the first place, because pain is usually the indicator that says, oh, something's going wrong. Let me go check this out and find out what's going on.
Back in my late teens, I started getting pain in my jaw. It was severe, caused migraine headaches, and I'd had them for years. It was awful. And then finally, I think after, I don't know how many years, I finally got surgery on my jaw, which helped a little bit. But I also had pain in my neck in my 20s, and it was severe, caused the migraine headaches also, kind of all connected there. And then I just kept getting more things, my legs, restless leg syndrome, and then pain in my legs. And after a few more years, I got pain in my arms. It was muscle pain and cramps and spasms, and couldn't sit for very long in the evening or go to sleep at night. You had to keep getting up, and just more and more things. Pain in my stomach, in my low back now, and it just got so bad that you just felt you couldn't deal with it. So many years ago, I'd say about 10, I found there was a lot more things that I couldn't do. It was like a completely change of life. It really depressed you because I couldn't do gardening anymore. I couldn't walk far. I couldn't drive far. Just so many limitations. You really had to accept a whole new person that couldn't do a lot of things you wanted to do. I'm afraid to go on vacation and visit sites because I knew I would just have to sit down somewhere and maybe not be able to walk back.
People will say to you, Kathleen, well, you really look great today. But they don't understand lupus. Lupus, you can feel perfectly all right one day or 1 hour, and the next minute you got a pain in an area that's unreal. And I found out, like, it'll tire you out a lot. So as to when I first was diagnosed with it, I was told to lay down for a little while, like a half hour or so, and then you would feel better. Well, the thing was, I would sit down and crochet thinking that was helping me, but it doesn't. You have to lay down and do absolutely nothing. Or it seems like I notice sometimes a change in the weather, it'll make it bad, or you'll just be walking along and you'll get that severe, and it is a severe pain that'll come out your ankle. And now that it's affected my lower back, down to my knees, you never know. It's just something you have to learn to live with.
It took years and years and years to be able to get more treatments, and it's just difficult to live with because it's a daily pain. It's here and there, and with the different problems, your neck, your back, your arms, your legs, and it's a whole new lifestyle that you had to give up so much, and but you have to look at the best in life and deal with what you have and enjoy that and go on from there.
The bottom line is that you do have rights in your care, and particularly around pain. You have a right to have your pain assessed and treated and monitored when you go into a hospital system. For example, the Joint Commission, who regulates and accredits a lot of the hospitals and some long-term care facilities in the states and across our nation, really monitor to make sure that pain is being addressed in the hospital system. But that should happen in outpatient systems, and hopefully it happens in your doctor's office as well, that people are starting to ask you that question when you go in. Are you having pain today? Have you had pain recently? And how's it working for you? Is it interfering with your life? How is it? And what can we do to make it better? We're going to be at FDA hearings in 2 weeks, and we have 4 people coming in throughout the nation to tell their story about pain and living with pain and living with medications, and what it means to them to be able to get to the right provider, to not be stigmatized, to get access to the right medications and the right non-drug strategies that will work well for them, and how it brings their life back, gives them their life back again. Most people that are going into the healthcare system now with a provider who is willing to work with them no matter the condition they have particular challenges with what is being recommended by the professional in their best recommendations and their expertise on what would work for this person, and then having that recommendation treatment plan written out and recommended, and whether the insurance plan that they have will be willing to pay. And I think that there's a two-front challenge that occurs. One's from the end of the provider, and then one's from the patient themselves. The provider oftentimes may be hesitant to even prescribe certain medications if they know that it's a top-tiered recommendation that will be may cost be excessively unaffordable for, or put an economic burden on the patient they're prescribing to. You know, and this happens a lot with pain management treatments. Mm-hmm. You know, the best example that I can tell you most recently is in regards to fibromyalgia. We actually did a survey, a national survey, looking at what were the most common barriers that people were having living with fibromyalgia and trying to get access to their pain treatment, and having the ability to either afford their copay or affording the tiered amount of medication to get access to the supply that's recommended, or being denied the medication completely because the insurance company has made a decision they don't want to pay for that particular medication that's been recommended. That is problematic. The other problem is what we call step therapy, or sometimes they'll call it a fail first policy, mm-hmm. where the insurance plan will make recommendations of several other treatment options that may include other medications that aren't necessarily top recommended medications from guidelines or FDA approved medications, or they may even be non-drug strategies that will be recommended that they have to fail each one phase by phase. So it may take several steps, may take 4 or 5 steps, meaning several months for each of those steps to be tried before they're able to even consider using a medication that the physician or a nurse practitioner or a physician assistant would be recommended as a first line of medication in the first place. Mm-hmm. Somebody other than the person that has done an assessment, a physical assessment, and a review of the history and a review of the condition and recommended treatment strategies, the healthcare professional decision-making process is being usurped by rules and regulation from another party, which I don't think most of us really thought was going to be how insurance provisions were going to be made, even in a managed care setting, and that can be that's very problematic. I mean, to me as a nurse, it's a direct interference with the physician-patient relationship, which I feel is sacred. I think it's very fair to say that in this present time, when we're concerned about health care and the economy and affording it, that there are decisions being made to be cost effective that is outweighing the need to be quality effective as well.